Chapter 14, Mental Disorders. Early stage, they lose short-term memory, which is those things that are more recent in memory. They have an inability to concentrate. They may change subjects in the middle of a conversation. They're not capable of learning new information. They have an impairment of reasoning. Sometimes they don't understand the whys of something. They have changes in personality, and as it progresses, their communication skills tends to decline along with it. Um, they may struggle, in fact, to find the word they want or use a word that doesn't even fit in what they're saying. Over a span of 5 to 10 years, there is a deterioration of their intellectual and physical ability, depending upon how early. There's also multiple types of this, so sometimes it depends upon which version of it they have. In late stages, they become increasingly dependent for care. Um, they decrease in their stimulus to anything outside of their immediate world. They become emotionally detached, restless. They have sleep disturbances. They may be up at night and sleep during the day. They may be totally confused in their timing. They are disoriented. They may not know where they are at moments and may be standing in the middle of their own house. They become hostile and combative sometimes, which means they sometimes are um, maybe more difficult to handle. Uh, they eventually become bedridden and die of complications associated with the condition. Um, a lot of times, if a patient has in poor health, their time frame of Alzheimer's may be less. If they are very healthy, they may live with Alzheimer's for a number of years. There's no real definite cause for Alzheimer's, but they suspect there is an age relationship since it increases with age, and that there is probably a genetic link, probably on chromosome 21. If there's been any head trauma in the past, they're at greater risk of developing Alzheimer's. And you can see that based upon things more recently, like some of the professional football players now are developing Alzheimer's who have had a lot of head hits and concussion during football games. Um, Other theories are biochemical changes in the brain, uh, autoimmune reaction, infection uh, with a slow acting virus that just happens in this way, blood vessel deficits, and deficiency of neurochemical things in the brain. Uh, Diagnosis wise, the criteria is going to show signs of memory and cognitive or um, thinking abilities. As it progresses, the neurological examination is going to reveal sensory and motor deficits. They don't move as well. They may not hear or see as well, or that kind of thing. In later stages, it will include brain scans looking for atrophy of the brain. Um, the biggest place that you're going to find an absolute diagnosis is going to be after death with during an autopsy, and it'll show that there's neurons lost, and it's going to show presence of amyloid plaque on the brain. But this So there's really no 100% diagnosis other than the cognitive deficit and declining of their abilities prior to that. There is no cure, no prevention. It's treated towards management of the symptoms. So research is saying that maybe exercise and socialization, being involved with other people, doing brain exercises may increase or may decrease the likelihood of developing Alzheimer's. It's also potentially related to stress and nutrition. So, a lot of thoughts on it. Um, but the treatment is aimed toward drug therapy, control of help control their cognitive decline, keep their mental abilities as long as possible, to remove their anxiety and depression and delusions, um, managing them from a health standpoint of their fluid intakes, their nutrition, and their personal hygiene, and protection from injury. Because they may walk out in the middle of the road with traffic, with a vehicle coming, and emotional support for the patient, but also the caregiver, because this is a tough one for family members to also live with and try to help manage. Vascular dementia is a reduction in blood flow to the brain, usually from a narrowed or stenosed artery. As it reduces the blood flow, it also reduces the oxygen, which causes brain cells to basically die off. Can be from the plaque of atherosclerosis. It can be from just a lack of oxygen to the brain, or it can be from an embolism. Symptoms they may have are disturbances in memory, judgment, thinking, personality. They may be apathetic or kind of I don't care, or just indifferent attitude. Disorientation, depression, restlessness, psychotic tendencies, and in the final stages, they typically will go into a stupor and coma. Drug therapy may help to increase blood flow. Also, they may go in and clear out the carotid arteries, and therefore allowing blood flow a little freer through the arteries and clearing out some of the plaque. Unfortunately, whenever there's brain cell death, it is not reversible. Dementia caused by head trauma. Trauma is an insult to the head, can reduce blood flow to the brain, causing dementia. The types of injuries that would do that is an open or closed head injuries, hematomas, that's causing blood flow to irritate the tissue. Skull fractures is another thing that we may see here. Usually the diagnosis is through imaging such as CT, MRI. Those kind of things are usually the best tools for this. And simple skull x-rays might also be a part of that. Looking at the physical and neurological evaluation also. Treatment is try to correct the damage, and therapy to retrain what functions are remaining. Alcohol abuse is caused by the physical and psychological dependence on daily or regular large amounts of alcohol. Excessive use is then associated with signs and symptoms like anxiety, behavior disorders, depression, insomnia. It sometimes may come on slowly, or it may, if it's a result of a traumatic incident, it may be very rapid. And since alcohol is a depressant, that would also bring into the picture the potential of the symptom of depression. Repeated heavy drinking of alcohol causes the symptoms and the signs and an effect to nearly every organ and system.